So hormones in general are chemical messengers that are produced by endocrine glands in the body. The ones that we're going to focus on today and that Melissa and I wanted to focus on are really sex hormones, stress hormones, and these hunger specific hormones. But I did just want to take a moment to say, just as part of what we do at the Blum Center, we often talk about in medicine the hypothalamic pituitary axis, which is a very fancy way of just saying the brain connects with all of these other glands, and it's all part of an interconnected system of how we secrete hormones. So when we talk about sex hormones, stress hormones, hunger hormones, how they affect weight, we are also keeping in mind what's going on with the brain and the pituitary and the hypothalamus, what's going on with the thyroid, though, even though we're not talking about the thyroid specifically, it's part of what Melissa and I take into consideration with every patient because all of these things are all interconnected. So we're going to focus on more of the downstream hormones that we'll get into in more detail. But all these hormones do work together to regulate different things throughout our body, specifically growth, development, your metabolism, your reproduction, your mood. And when it comes to body weight and why hormones are so important is because they regulate everything from appetite to how full you feel, to how much energy you're conserving, how much you store in fat, where you store it in fat. All of that has to do with all of these different hormones or messages that your body are getting all throughout the day. So that's kind of an overview as to what hormones are. We can kind of jump into the nitty gritty now, if that's okay, and get into sex hormones. So what are sex hormones? We kind of break these down into two broad categories. We have what are considered, traditionally female hormones and traditionally male hormones, although they both play a role for both. In females, we usually think of estrogen as the dominant hormone. It's the dominant sex hormone that's responsible for body fat distribution. So where you're putting fat, how you're burning fat, appetite, metabolism. And we can kind of think of this in two different ways. So if we think about women who are still cycling, who are still getting their monthly periods, there are all sorts of things that can cause imbalances in your hormones. Ones we see a lot of are things like polycystic ovarian syndrome or things like estrogen dominance, where you have too much estrogen for various reasons, which can make it really challenging to get weight off. Those patients will often complain of I feel bloated, I have a lot of breast tenderness, and this weight just won't come off, no matter what they do. And then later, as we transition into perimenopause and menopause, we start to feel the effects of complete deprivation of estrogen to our cells. And that manifests in a different way too. That starts to increase what's called your visceral fat. So we start to see more fat accumulation around the organs, which has more detrimental effects to your health down the road. Also low energy, fatigue, and again, that feeling like you're doing the exact same things that you used to. You're eating well, you're going back to all the tools in your toolkit, and weight is either just continuing to come on or it just won't come off. Also, there are obviously other hormones for women, testosterone and progesterone, and the balance of those hormones that plays a huge role. And then in men, we think of testosterone as the main male hormone. Women do have testosterone also. They have about 1/10 the amount that men have. It's important for both men and women for everything from libido to energy. But when it comes to weight, it really can kind of set the tone for your metabolism. Without testosterone, we can't put on lean muscle mass, and that lean muscle mass is what helps us to burn fat more readily. We put on the muscle and it burns the fat. So that's a really important one, looking at imbalances in testosterone. And for men too, they can have imbalances where they have too much aromatase activity, meaning that they are converting too much testosterone to estrogen, which can cause them to put on fat they can get more breast tissue development, a lot more weight around the midsection like women do. So that's kind of just a brief overview of the male and female hormones and how irregularities in any of those can really make it next to impossible to take weight off if we don't address the root cause.
And what, Macaulay, would be medical ways of addressing that?
Yeah, so as far as how you can kind of figure out if that, aside from just talking to the provider to kind of get a hint of what's going on, we would address it medically by getting lab work done, which is something that we do for everyone. If you're a woman still getting your period, the lab work would have to be during a certain time period. And then at the Blum Center, we have the benefit of the specialty testing. So if we can, we get something called the Dutch test, which looks at all the metabolites of estrogen, progesterone, testosterone, among other things. And then medically, luckily, there's a ton that we can do to actually balance out these hormones. Once we figure out what the problem is it that you're not detoxing estrogen well enough? Is it that you don't have enough progesterone? There are a lot of supplements and herbs that we can use to help detox estrogen and bring the hormones back into balance. There's supplements and lifestyle modifications I'll let you touch on in a second to help boost your own natural testosterone and other things. And then for a lot of patients, we do consider hormone replacement therapy. I'm a huge advocate for that, if it's right for you, to kind of bring your levels back up to what we would consider physiologic. So where you would be, in your 20s and 30s, in addition to all of the lifestyle things. But there are tons that we can do medically, both with supplements and pharmaceuticals after we get the right testing done to see.
And very often the hormone replacement is compounded, right? It's personalized.
Yeah, that's a great point. So again, there are so many options with hormone replacement therapy, which I do think is why it's so important to work with a provider in a place where you can really have a lot of touch points, a lot of check-ins, see what your levels are before and after, because we do often use compounding pharmacies to personalize your regimen. For some people, they use creams, there are patches, there are pills, and any combination of the above. And it really depends on, what your symptoms are, what's the minimum dose that it takes to alleviate your symptoms, what makes you feel good, and having that, back and forth and ability to personalize it is really a great benefit of these compounded pharmacies.
And Macaulay, there's a question that says, can you talk about how Tester 1, I'm not sure what that means, isn't FDA approved and many doctors don't like prescribing them?
Oh, testosterone. Okay, that's a great question. So I actually, I should have thought of it, but I'll find a way to get it to you guys, some studies that have recently come out. So testosterone is FDA approved for men, and not for women. And there are more and more data coming out on this as we're finding how important it actually is for women. In addition to that, if you are replacing things like estrogen, so if you're doing HRT for other things, it can decrease your testosterone a little. So it's really important that if you're replacing these other hormones, you replace testosterone too. And testosterone has huge benefits for women, especially once you're postmenopausal, in protecting your bone density, helping you not put on more and more weight. So there's a lot of studies being done on that. The reason it's not FDA approved for women right now is simply because, unfortunately, women have traditionally not been studied to the degree that men are. And that's changing, I think. So we do prescribe it all the time. I prescribe it all the time. What we have to do is just use a compounding pharmacy and give about 1/10 of the dose that a man has. And luckily, testosterone is very, very easy to monitor in your blood, which is an insurance-based test. We test your total and free testosterone and then replace it with a compounded cream. So it's a cream that you would put on and retest it a couple weeks after that. And so that is addressing the FDA approved. Many doctors don't like prescribing it. It is a controlled substance, so they have to have a DEA number to prescribe it, but we do it all the time at the Blum Center. It's something we're very comfortable and experienced with. But that was a great question.
Then someone's asking about what's your opinion regarding HRT and breast cancer?
So another great question. Again, there was a study about 20 years ago that has since been pretty much debunked. And I think, unfortunately, it has instilled a lot of fear in people. That was a study done with oral equine estrogen. So estrogen taken as a pill that was made from pregnant horses' urine. We do not use that anymore. That's not bioidentical, but that's what was studied. and it got some people concerned about breast cancer risk. We now know, and there's tons of data, again, I can link these studies for you, that there are zero increased deaths from breast cancer associated with hormone replacement therapy. Of course, to Melissa's point about not being able to answer and generalize, we get a very full history. The only, I shouldn't say the only, one of the things, if you personally had a history of breast cancer, you have had breast cancer yourself, that would be a different discussion and one that should include your oncologist. But vaginal estrogen is still approved for women who have breast cancer. So that's, again, there's so many options. Even if you can't take the patch or cream, there's still a lot of treatment options in order to at least alleviate some menopause symptoms. That won't help with the weight part, but there are other supplements like black cohosh and some lifestyle things that we can do that would still really help with that. So it's so personalized, but we don't worry about increasing the chances of breast cancer much anymore with HRT. That's been pretty much debunked.
Perfect. And for those on estrogen blockers, are there options?
That's another tricky one, but there are options. And think so many people have been kind of denied these options. I'm assuming by estrogen blockers, you mean things like tamoxifen, something that a breast cancer survivor would be on. Absolutely, there are options, vaginal estrogen being the main one. But there's more and more data coming out of that. And I can link this too, but I follow this wonderful doctor who's a breast cancer survivor herself, who is kind of leading the forefront on getting all this data out there. And there are a lot of, again, natural ways that we can combat. Those medications themselves have a lot of side effects. So that's a little specific, but I'd be happy to talk to anyone about that individually.
And we're going to take two more questions on sex hormones, and then we're going to move on to lifestyle in sex hormones. So the next one is, if women are on HRT, will they be on it for life? If not, won't the symptoms they're trying to avoid come back once they come off it?
Okay, I don't know why I'm not seeing that one on mine, but say that again. So if they're on HRT, do they have to be on it for life? The answer is no. There is something called the timing hypothesis, which is that we think the main benefits of HRT are achieved if you take it within the first 10 years of being on menopause. So that's a fancy way of saying the sooner the better. And those benefits that we're talking about, I mean, we're talking about weight, but that is a nice benefit of HRT. The bigger picture ones are also brain health, so preventing dementia, bone health, preventing bone loss as we get older, and heart health. So preventing heart disease is still the #1 cause of women. So those are 3 big reasons why we consider HRT. So the sooner the better. Do you have to be on it for life? You don't. A lot of women will get off of it and see how they feel. Some go back on it. So that's a very personalized decision. But yeah, a lot of people stay on it for about 10 years and then go off of it. It depends if you were going on it to get rid of symptoms or because you're looking for these longevity benefits. So it's a bigger conversation, but it's not a one size fits all. And definitely there's no wrong answer, but the sooner the better.
And what about hair loss with testosterone?
So, too much testosterone can cause hair loss. Testosterone imbalance in women in general can cause all sorts of issues. Not enough testosterone can also cause hair loss. Lack of estrogen will also cause thinning of hair, brittle hair, dry skin. So that kind of brings us back to getting back into balance. And I guess my main point with that is with any hormone replacement therapy, it's all about monitoring your levels. So you really want to make sure you're with a provider who's going to check your baseline labs. And for us, we check a Dutch test to check all your detox pathways, start the hormone replacement, and then check in with you. You should have a check-in point to see how are you feeling, and to recheck those labs to see that your levels are good, which is something that we do. It's standard for us, because there are issues if you are too low or too high. One of those issues can be hair loss. So that's something I haven't had much of an issue with, but I think it's because we start very low, we're conservative, and it's the start low, go slow kind of approach.
Awesome. So besides the medical, the pharmaceutical side of it, there's a lot that you can do through lifestyle. And one of one of the threads amongst all three of these categories that we're addressing today is food. And I would say, in fact, the tenets are the same for all three. And really, it is the pillars of functional nutrition. And so some of you are probably familiar with this, but I think it really deserves revisiting, because even those of us who live it every single day need a reminder every once in a while. Number one is making sure that at least half and 3/4 of your food every day comes from produce, a lot of vegetables, a little bit of fruit, making sure that you're having healthy fat like avocado, like olive oil, with each meal, and having healthy proteins at each meal. And the big one, and this is really important for your hormones, is minimizing packaged foods. Not all packaged foods are bad, but really minimizing the processed foods and the ultra processed foods. And so what does that mean for us? It means learning how to really be a detective and look at nutrition labels. And I think that that's one of the big pieces of this puzzle, because when you look at a package, so often it's health washed and it makes it sound like it's really healthy, but it might be just completely laden with sugar. And sugar is not your friend when it comes to your hormones. So you want to make sure you're looking at the ingredients. Are you willing to eat each one of those ingredients with a spoon? You're looking at the grams of sugar. Drives me a little crazy that our nutrition labels are in grams. Most of us don't know what that means, but 4 grams equals 1 teaspoon of sugar. Really, ideally, you want to stay under 24 grams of added sugar a day. So what does your sugar intake look like? It has a huge impact on your hormones. And thirdly, how many grams of fiber are you eating? So when you're looking at that gluten-free bread, when you're looking at gluten-free pretzels, if they have 0 to 1 gram of sugar, 0 to 1 gram of fiber per serving, you're essentially eating sugar, because the moment you eat that food, your enzymes in your saliva are starting to convert it to a sugar. And like I said, sugar is a huge component of hormone health. If you're having 2 grams of fiber, you're kind of on the threshold. You want to look for at least 3 grams of fiber or more. You want to make sure that you're physically active. So you want to have some cardio. I like HIIT workouts, high intensity interval training. It doesn't have to be necessarily going to a gym. It could be something like interval walking at an active pace for a minute, and then increasing your walking to be almost as fast as you can for about 30 seconds, coming back down to active walking for a minute, and repeating that off and on for about 10 minutes. Doing that daily can have a huge impact on your hormones. Managing stress. So stress is the fuel of the fire. And that's also when it comes to hormonal health. Managing stress influences your hormonal levels in every realm. So learning how to mitigate the effects of stress is really important, as is getting enough sleep. One of the things Macaulay and we were just talking about this a couple of days ago, was we have an entire country, it feels like, of people not getting enough sleep, and how to learn how to prioritize sleep and get yourself to sleep. Your sleep can disrupt your hormone levels, and in fact, it can increase your appetite. So I'm going to check the chat for any other questions? No. So that means we are going to move on to your stress hormones.
All right. So that's actually, just in talking about sleep, it's actually a great segue for us into stress hormones. So stress hormones are the main hormones that we're talking about that are secreted by the adrenal glands. The adrenal glands are these 2 little glands that sit on top of your kidney, and their main jobs are to secrete DHEA, which is a precursor to estrogen, testosterone. And the big one that we hear about a lot is cortisol, which is the stress hormone. And kind of to Melissa's point about so many of our patients are not getting a lot of sleep. So cortisol is you're supposed to have a stressful event and your cortisol spikes up, and then that's supposed to resolve, like the lion's chasing you, your cortisol goes up, and then you're out of harm's way and your cortisol is supposed to come down. So cortisol can be really helpful in those short spurts. It mobilizes glucose from your muscles. It gives you energy. You start to conserve your fat because your body perceives you to be in this stressful state. However, our lifestyle now, and I'll let Melissa talk more about this, is this 24/7 cycle, and there's just not that same come down. So what we're seeing is more and more people who are just running around at a constant high cortisol state. And medically, what we see from this is a lot more fat storage around the midsection. We have patients who tell us, like, I'm doing everything, I'm exercising, sometimes over exercising, sometimes overly restricting, I'm hardly eating, and that weight just won't budge. And that is truly, it's the cortisol that just keeps that weight around the midsection, that chronic stress, because our body doesn't know the difference between, I'm just stressed because of the constant news cycle and work versus I'm in an actual danger. And that's why part of the reason why we tend to hold on to fat that way. Cortisol will also lead you to feel like you have to overeat. You don't feel as satisfied. You'll really start craving specifically sugary foods. It slows down our metabolism, so it's very hard to burn fat. Your body's really conserving it, putting it more into fat cells. It starts to raise blood sugar levels, which over a long period of time can lead to insulin resistance and things like prediabetes. So without getting, overly technical about the whole process, a lot of what we see when we check for this is, people who just cannot lose the weight, and it's really getting distributed in a different pattern for them, that midsection. And that's actually the weight gain that's more concerning as far as what it could mean for your heart health down the road. So it's really important to get to the root cause of. Yeah, so I think then what can you do about it as far as the medical side? This is one area where I do have to say, I think the lifestyle interventions, which I know are the harder ones, are really the mainstay of treatment. But as far as what we test for, we, again, in our blood work, we would test for it. We test for DHEA levels, which give a little bit of a glimpse as to how the adrenals are functioning. We can also test for a morning cortisol, which is helpful to see if that's high or low, although that's just a snapshot in time, and can be really affected by what you eat or your night's sleep. And then the Dutch test, again, that test I was talking about before, also looks at our adrenal glands, and it lets us take a look at something called the CAR, your cortisol awakening response. So we look at cortisol through the day. When you first wake up, a little while after you wake up, it's supposed to spike up. It's supposed to slowly go down. So we check it kind of in the late afternoon, and then it's supposed to come down so that you can sleep at night. Often when it's very high, we'll also hear people saying things like they're tired but wired, then they don't sleep. And that also affects overeating, and it's really a vicious cycle. So medically, there are things that we can do about it. It is a lot of lifestyle, which can be hard work. Supplements can often help in supporting the adrenal glands and bringing, things like calming herbs and adaptogens like ashwagandha, rhodiola, depending on the situation, can really support. But with the adrenals, it does take time to really help address that. And then the big ones are the lifestyle things, which I'll let Melissa kind of dig into.
So Macaulay, when we think about stress, so many people have just kind of low grade chronic stress that goes from day to day to day. And in fact, they acclimate to it to the point where sometimes they think they're not really even stressed anymore. Does that kind of low grade chronic stress also lead to this kind of hormonal imbalance?
That's a great point. So it does. That's really the main cause of it. It's really not the acute, oh, I'm so stressed because something just happened and then it goes away. What it is that causes the issues with cortisol that really contribute to the weight gain is that low grade chronic stress. And like Melissa said, a lot of people don't even realize they have it because we're just so used to operating this way. I know I've been there myself. So kind of over the long term, that level of elevated cortisol over a longer period of time is what causes the problems. It's not the quick up and down. Our body can adjust to that. And in fact, that's a helpful response to a lot of things. So where the issue really comes in is that constant elevated level of chronic stress that never really goes away.
Thank you. There's a question, what are your thoughts on ashwagandha and thyroid disorders?
Um, I would have to know specifically what the thyroid disorder is, so we could talk about that a little bit more. I mean, when it comes to addressing the adrenal glands, we never address what's going on with the adrenals, like with cortisol, without looking at the thyroid. So I don't know if that answers your question. We would have to see, what your TSH is and your other levels are to see if you're metabolizing things well. So we do tend to address the thyroid before coming up with the treatment plan for the adrenals. So that would kind of dictate whether ashwagandha would be appropriate or not. And what other medications you're on, because there are things like licorice fruit that we use a lot for the adrenals, but we couldn't, for example, if you had high blood pressure. So it is kind of a tricky because the adrenals also do regulate blood pressure and they're interconnected with the thyroid. We take that into consideration when coming up with all the herbs and the protocols for that.
Right. And Sarah, we're going to answer your question about the cutting out of sugar and dessert for our next slide, because that fits in perfectly with our next slide on appetite hormones. But to talk a little bit about cortisol, your stress hormones, and what you can do from a lifestyle point of view. In addition to the food is always important, but lifestyle wise is slowing down. It's we live a very go life, and in fact a lot of times when I sit down in front of clients, they tell me that they feel a lot of anxiety when they slow down, which just exacerbates the whole thing. So learning how to have self-care, and what's my definition of self-care is carving out the time that you need to take care of yourself on a daily basis. It doesn't have to be a manicure pedicure. It doesn't have to be a bath. It doesn't have to be those things that you're seeing all over social media. It might be taking 15 minutes to sit down at a table with your food for lunch. It could be taking 15 minutes before your day starts, before you open your computer. And just taking a few moments for yourself, whether it's journaling, whether it's doing some deep breathing, maybe it's a walk outside. And it might be taking that and then starting to build on it so that you're able to slow down your parasympathetic nervous system and keep things in check. Often people talk about mindfulness and meditation. Those are very strong modalities, but you don't have to start there. And I always think it's important to start small and to build on it. Very often what we see this time of year is people saying, okay, I'm going to start meditating 40 minutes a day. And so they start. And then usually by February 1st, that goal has been abandoned because it's just too much. And so starting small, what is the least amount of a mindfulness exercise that you can do every day, even if it's a minute? I worked with a very, very busy single mom who had a job. She was working full time and she's like, I don't know how to slow down. And the thing that we came up with was when she got home from work, before she went in her house, while she was sitting in her car, in her garage, that she would do 3 minutes of guided meditation. And she started doing that every single day. And after a couple of months, she said it just made such an enormous difference in not only the quality of her life, but the quality of her relationships with her kids. So learning how to slow down is a huge component of helping your stress hormones. I would also, in addition to the food tips that I gave with the first slide, is consider going alcohol free. And I would even say consider going caffeine free. And maybe you don't do it overnight. Maybe you wean down, because both of those are drugs, right? One is a stimulant, one is a depressant, and they both have impacts on your hormones. Okay, now I'm going to check just to see if there's any other questions before we move on to hunger hormones.
I see the question about cardiovascular workouts and cortisol, which I actually think is a great point because, sometimes we think more is more, and that's not always the case. And with cortisol, especially, Melissa talking about just taking these few minutes, I really like the tip about the car. I feel like I should try that myself. But with working out, And Melissa had mentioned before HIIT workouts. It's really good to cycle though. I like the HIIT workouts because they're short bursts of intensity versus doing a ton of high intensity workouts all of the time. Sometimes I talk to people about things like zone 2 versus zone 5 workouts. So it's nice to have maybe one time a week where you're really pushing yourself. But other days there's, zone 2, meaning you're just getting a little bit breathless. Which is really able to help with your cardiovascular health without increasing your cortisol levels. If you do over exercise, that can absolutely affect your cortisol levels and make your struggle to lose weight even harder. So that's kind of part of what like a personalized plan might look like for you once we're addressing cortisol levels, is to both work on ways to bring those levels down, but how can we come up with a workout regimen for you that would optimize your cortisol level so you're not operating at a high level. Like I do see a lot of young women who are just over exercising a ton in this effort to lose weight, whereas they're really elevating their cortisol level so much that their body's holding on to that weight even more. So how should you limit it even if you really enjoy it? I was the same way. I was a total running addict. I still love running. So just alternate it with other things. I still will run a half marathon a couple times a year, but do weightlifting, strength training a couple other days if you can. Do like what Melissa said, the interval training is really helpful because you're pushing yourself, but then you're letting your heart rate come back down. It's all about that recovery. And then if you can, and this has been hard for me too, try and incorporate something like yoga, like once a week. Could be very little, but something that's a little bit different to just regulate your nervous system so you're not always go, 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 both in your life and in your exercises. It can be really helpful.
And this is also true for those of you who might be using exercise as a way to quote unquote relieve stress. If you're using high intensity kind of workouts all the time, you're actually adding more stress to your body rather than you may feel a relief of the stress in that moment right after you exercise, but ultimately in the long run, you're actually stressing your system more. And in fact, I used to do that all the time. I would go to I'm a 3rd degree black belt in karate. I would use the heavy bag as a way to relieve my stress. And a smart person said to me, you need to have a little bit of yin with the yang. You need to balance it. And so adding like the yoga or Pilates or Tai Chi or Qigong can be a really fantastic way of bringing balance to really high intensity cardio workouts.
It's a great question.
So now we're going to move on to hunger hormones.
Great. Yeah. So hunger hormones, I feel like we've heard a lot about these other hormones for a long time. And I feel like hunger hormones are starting to get their moment in the spotlight, and we're still learning so much about them. I'll just give a brief overview. So these are not secreted by one particular gland like these other hormones, but kind of different parts of our digestive system. So the first two I'll talk about quickly are leptin and adiponectin. Those are actually secreted from your fat cells, which I think is important because we often think of fat as just this dormant thing you put on fat and then, you try and take it off. But it actually is a metabolically active tissue, meaning that it does stuff to your body. So as those fat cells are there, they're affecting other parts of your body. So leptin is a hormone that signals the brain that it has enough energy stored. So you should, it says you have enough, you can decrease your appetite now and increase your metabolism, which is great. There is a situation that we're seeing more and more, though, where people who are overweight have actually very high leptin levels because their cells are becoming resistant to it and they're not recognizing that those satiety signals. They're no longer recognizing that they're full and that they can stop eating and increase your metabolism. And we think now that that might be another sign of early metabolic disease, like early pre-diabetes. So that is one thing that we are measuring. Another is adiponectin, which also when we have been checking in overweight individuals has been found to be very low. So when they looked more into it, adiponectin is another hormone produced by fat cells, very important in glucose regulation and fatty acid breakdown. So you need this in order to maintain your blood sugar, and it's regulated by your fat cells. When it's very low, there's more difficulty in regulating your blood sugar. Again, it can be considered like a precursor to prediabetes. Ghrelin is actually produced by the stomach. It's called the hunger hormone, and that's because it's what actually causes you to feel really hungry. It's also produced, so it goes higher when you eat, when you exercise. Again, that's one of those ones that when you're over exercising, it's another thing that effect it could have. Too much ghrelin release, and then you overeat because your body's, sending you those signals. It can also go up with things like extreme caloric restriction. So people who aren't eating enough, their body tries to override that. Lack of sleep and stress will also increase ghrelin. So I thought those were both interesting triggers for increasing ghrelin. And then probably the most famous of the hunger hormones is insulin, which we've known about for a long time. That's secreted by the pancreas in response to increased blood sugar levels. Very important in signaling to the brain to reduce hunger after eating. And again, more and more what we're seeing in patients with insulin resistance is that their body is no longer responding properly to insulin, and they're having to produce more and more in order to get those signals to the brain. So all of these different hormones, and I'm sure there are more, really interact with our GI system and sending signals to the brain to know when are you full, when are you satisfied, when are you still hungry, when should your body conserve energy, when should you spend more energy, when should you store more in fat. So you can see how any dysregulation in any one of these can cause you to have huge challenges with weight loss.
And what do you do, Macaulay, medically
Yeah, so this
in
is
these
probably
cases?
the area that we can do. I mean, in all of these areas, we do very similar things. One kind of newer area of this field is to check for genetic markers, and I probably should have mentioned them with these other ones too. We do know that there are certain genetic mutations that are very common that can cause imbalances in any of these hormones and in the other hormones, like in estrogen detox. So it's a new area of checking actually genetic markers to see if you have a predisposition that might make it harder to lose weight, because that helps us to come up with the treatment plan. We also check for insulin resistance. We check a fasting insulin. We monitor people for diabetes. We have a lot of tools in our toolkit for this at the Blum Center. We have programs like our continuous glucose monitor, which is a little sensor you put right in your arm that allows you to see what your blood glucose levels does throughout the day. Melissa and I also run a program where we use semaglutide, which is the generic name for Ozempic, which is class of medications that was originally developed for diabetics. I'm sure a lot of you have heard of it. It's kind of all over the news. Ozempic and Wegovy and Mounjaro are all in a similar class that we do use as a tool as we're trying to get to the root cause of why you have difficulty losing weight. And supplement support. So there are a lot of supplements, botanicals, adaptogens that we can look at, and micronutrients. So a lot of people are deficient in certain nutrients that are really important for balancing blood sugar. So we check for those too, things like chromium and magnesium. And then we can supplement those too. There are things like berberine, chromium, cinnamon, that really help to balance blood glucose levels. Again, this is where lifestyle really does play a huge role as well. There's no shortcuts here, as with anything, and I'll let Melissa talk about that. But it's really checking those baseline markers. And as part of our weight loss program with the semaglutide, we do actually check leptin and adiponectin. And then I recheck it a couple months later after doing the work with Melissa on lifestyle and with me with the semaglutide to see if those have improved. So they're really things that we're able to utilize now as markers to make sure that your body is primed to lose weight and you don't have things that are fighting against you.
And this is one area where there's all of these areas, there's lots of different options, but it seems like, Macaulay, that with the hunger hormones and insulin resistance, that it also really depends on what the client or patient's goal is.
I think that's absolutely right. There's, and people's comfort levels. Some people are comfortable or wanting to be more aggressive. Others want to, go more of a slower, more natural route. I think the main thing is to do the testing and hear the story to get to the root cause of it, because no matter which way you go, you have to correct the root cause or the weight will just come back. So that's the big thing is, these are all helpful tools as we start to kind of uncover through testing and lifestyle what was really driving you to hold on to the weight to begin with.
One of the questions that I get a lot is if I use semaglutide therapy, does that mean I'm going to be on it the rest of my life? And am I going to gain all the weight back after I finish?
Yeah, I think that's such a good question. And I think there's been a lot in the media about that. And I get that same question a lot as well, Melissa. And I think that's where couple things play into it. I think the people that we hear about that are on it for a lifetime are usually obese or morbidly obese when they start on it. And we now know that there are a lot of genetic reasons that would predispose someone to obesity. And so I think where it's possible, and these tests can be expensive, to do some of the genetic testing or to take a really good family history and understanding some of the predispositions that are there. And for a lot of those people, you know, being on a medication like semaglutide to lose the weight can save their lives in so many other ways: heart health, blood pressure, all of these other things. But for other people, and understandably, because I would be the same way, who aren't wanting to be on the medications for a long time, we've successfully used semaglutide just as a tool to either kickstart your body to start losing weight while you're doing the work with Melissa and I to uncover the root cause. Usually it's more than one thing. You know, it could be thyroid and your hormones, or relearning how to eat now that you're menopausal, and addressing your cortisol level. So often it's so many of these things. And I've had a lot of patients very successfully get off of it, but it's really important to have an exit strategy, a lifestyle, you know, kind of plan. I think if you don't change anything that you're doing while you're on semaglutide, you probably will gain the weight back. So that's kind of our job, the patient and Melissa and myself, is to we work as a team to come up with why were you holding on the weight to begin with, what changes can we make, and then what's our exit strategy to help you maintain the weight loss. And we've had really good success with that.
And of course, the things that we've talked about lifestyle wise are all really important, from getting enough sleep and managing stress and movement, of course, fitness. And then there's the food. And there's several questions in the chat about the food. And, you know, here's the thing. For so many people, particularly in the United States, ever since we were really little, we've been kind of fed this notion that we need to eat low calorie, low fat. And that has given rise to a lot of other issues, because when you reduce the fat, most people increase their sugars. And so many of the packaged foods that we are exposed to day in and day out have a very high sugar content. And if they don't have a very big high sugar content, they don't have any fiber in them to help mitigate the effects of sugar. And over time, that's just disrupts all your hunger hormones. And so that's really one of the main focuses when you're starting to work on food, is to optimize your protein, optimize healthy fats. We don't believe that you should be on a low fat, low calorie food plan. So optimizing your fat and being very, very choosy about the carbohydrates that you do eat. There's different tools that you can use for mitigating the effects of carbohydrates on your blood sugar. And learning those tools, I think, are really important, and to use them based on the individual, right? There's no real general thing. I could sit here and tell you a food plan that I think would work for a lot of people, but the reality is it has to fit into your lifestyle. It has to fit into what will work for you. I mean, how many people on this call have ever been on a diet? How many people have been on the diet, and when they've lost weight and they stop the diet, they've gained every single pound back plus more? That's 85% of the people in the United States. And so you have to be able to take a food plan and really customize it in order to make it work for you long term. A couple of the questions in the chat are really, I think, important. I cut out added sugar and dessert, which previously consisted of usually snacking and dessert after dinner. It's been 2 weeks and I have noticed, I think she means I haven't noticed any difference in my weight. I eat very healthy. Any thoughts or things to look out for? So so that's a great start. cutting out dessert and not eating from when you finish dinner until the next morning is a really fabulous place to start. And then to build on that. So what does the rest of the day look like? I'm sure Macaulay can tell you the exact same thing. We've worked with loads of people who come in and say, look, I eat a really healthy diet. And that's not to say that you aren't, but that your healthy diet doesn't quite align with what we perceive as a healthy diet. Like, how much of your food every day is produce, for example, right? So getting to those pillars of functional medicine that I discussed at the very beginning, and then using that as your foundation.
Sadly too,
What
if you, even with a healthy diet, what we're talking about with sleep, another thing, if you're very stressed and you're not sleeping, just as examples, you could eat the most perfect diet in all the world and the weight just won't come off. And it's because of all these hormones that we talked about. They're actually signaling to your brain to hold on to it. So until we disrupt that cycle, it can be really hard to lose the weight.
It's such an important point. What kind of food regimen do you use for weight loss? Keto with carb cycling or something else? Probably something else. But again, it really depends on the person, and we tailor it to each individual person. Most people, when they go on a diet and they come off, they gain the weight back. So it's got to be something that is sustainable and something that's effective and something that you can live with really for the rest of your life. And I think that's the last question on hunger. So let's try to bring it all together. You have some parting thoughts on all of this when you look at it together, Macaulay?
I mean, all the questions have been so great. I think, it's so frustrating when people are, trying to implement on their own a lot of these different things. And I think just in hearing this all together, the idea of personalized medicine, whether it's at the Blum Center or anywhere, but someone who's going to really look at all these different areas, because even though we talked about these hormones as separate categories, they're very interconnected. It could be easy to think of these as different body parts, different systems, but looking at it kind of all together, both doing all of the testing, and then coming up with a really good plan to address all these different areas so that when you do make the lifestyle changes and eat the healthy food and cut out the sugar and all of these things, that you're actually seeing the results. And I think more and more our testing has gotten better and better. We can measure hormone levels before and after for all these different hormones. Patients are able to keep working with you, Melissa, to have these touch points all along the way. We have tools like the continuous glucose monitor, like semaglutide. There's so many different options out there. So you just have to really get someone who's going to personalize it for you. And like the food plans was a great example. Melissa's such an expert in that area, but it's going to be different for every person depending on the lifestyle. So I think that would be like my big takeaway, is to do the testing, look at the big picture, and then come up with have a very personalized treatment plan.
And I think your point that all of these things are interrelated and that we're talking about them separately, but in fact they're all connected, is really important. And so I assume that when you sit down with someone for the first time, that you're not necessarily looking at these systems individually, you're kind of looking at all of it together. Is that right?
Exactly. It's, that's why our appointments are longer than traditional doctor's appointments. We meet with people for an hour, hour and a half. And that's because, we really want to hear the full story. Even something you may not think is relevant is really relevant to us and gives us a bigger picture so that we can know what tests to order, where to start doing our detective work, what's, the best things for you, Melissa, to start digging in with them about, and really taking a more kind of macro look at things.
And there was one last question that just came through. What is the goal of using Ozempic? What is the objective?
Yeah, so the objective usually for patients is weight loss. It is also FDA approved for diabetes. It's also FDA approved for weight loss. The patients we see mostly coming to us are using it for weight loss. They've often tried a lot of other things, and the way it works is it does balance your blood sugar. It works both on the brain to decrease feelings of hunger, and it works on the stomach to slow down the transit of food through your GI system. So it works both locally and centrally to help you kind of take in less food, honestly, and to lose weight and balance your blood sugar. And now it's being showed to reduce blood pressure. I think there's more and more. I think we will continue to see more and more data coming out over the next couple of years on this. But the objective is usually weight loss, and we use that kind of as a tool simultaneously with the testing that we normally do at the Blum Center and the health coaching, so that we're addressing the root cause while the Ozempic or semaglutide is helping with the weight loss. So it's kind of a dual approach.